Thank you, Dr. Keska, and thank you, Dr. McDermott. So good afternoon, ladies and gentlemen. Thanks to Dr. Gilada, he's always been inviting me to these conferences, and he's always given me a flexibility to address whatever I would like to address. So I very much appreciate that from his side. I'm not going to speak to you much as a researcher, though I'm, by origin or training, I'm a social scientist, and I have that research perspective. But because of my work as the country director of UNAIDS here in India for the last 3.5 years, more as sometimes as a diplomat, sometimes as as a politician to a certain extent, and sometimes just as a manager. I'm the country director of a program of course, many of you, if not all of you, have heard about, and in the slides before it showed, of the joint UN program on AIDS, which is UNAIDS. Now, UNAIDS was, as my predecessor was also speaking of the history, was established in 1996, basically. And over the years, it has included many different organizations, UN organizations. So it's called a program. It includes World Health Organization, UNICEF, UNDP, UNFPA, UNESCO, ILO, UNODC, different agencies. The idea being from that time on, from the sort of mid-90s onwards, that in terms of objective, if we want to address the issue of HIV, it must be addressed in terms of support for HIV prevention, treatment, care, and support in countries and communities across the world. But also we must look at the socio-economic aspects, the broader aspects, the determinants, drivers of the epidemics, look at it in a cross-sectorial fashion, and what is the impact. As such, again, as Dr. McDermott was saying before me, it becomes a social, a developmental, and eventually a political issue. UNAIDS has a board. I mean, this is detailed, but where there's, I would say, about 20 or 30 countries, donor countries who contribute, has a common budget, and that budget is then a joint budget which is divided across the different countries. Now, it will come as no surprise to you, as the sign of the times also. UNAIDS, like all the UN agencies, like global international work, is facing financial difficulties. And partly it's because of what's going on in the world, and much more resources are going towards security issues, migration, and refugees. Historically, the role of UNAIDS, and up until today, is really around advocacy, obtaining political commitment, around ensuring with WHO strategic information, going from estimates to surveillance, to behavioral surveys, to situation assessments, to monitoring and evaluation, and so forth, in terms of support in planning and implementation, and in terms of partnerships. Over the years also, you have known there has been high-level commitments and frameworks put in place. HIV was at the height of attention in the late 90s, in the early 2000s, still I would say about the mid-2000s, under the Millennium Development Goals, which defined HIV as one of the priority in terms of addressing and fighting leading the response. There has been basically nearly every 5 years, up until June of this year, high-level meetings where commitments were obtained from the different countries on different objectives and so forth. To a certain extent, these have been successful. To a certain extent, of course, as many things at the international level, some of it just becomes paper or rhetoric. It depends how you take it afterwards. But, broadly speaking, now we're in a new era of Sustainable Development Goals from 2016 to 2030, where if in the subscript there is still the ending of AIDS as a public health threat is a goal which is inscribed there. But since the broader vision is focusing on development, on climate change, on education, on broader issues, it doesn't appear as visible as before. Again, a sign of the times as well as funding, sort of funding for a single disease is becoming less than what was the situation before, and including in India. Not that it has disappeared. I mean, there's still, and I will talk to you about funding, financing. We still have funding in terms of the Global Fund, which has a focus on AIDS, tuberculosis, and malaria. And India still currently receives the second largest grant in the world after Nigeria. There is still in India, though through the government, resources basically aligned through them, the World Bank funding, and there is, to a certain extent, through the US government, and particularly the PEPFAR, the presidential program focusing on AIDS. One issue that I wanted to talk about, which is important, is that of partnership. And I think it's underlying this conference, and it's something that comes to mind every time I do come to the conference. And it's obvious that if we look at partnership around AIDS, it involves government, and that we spend a lot of time with. It involves the communities, and involves civil society, and those we do spend a lot of time with as well. The international partners, where there's less energy and effort done is with regard to, and I know different people are going to bring it up, is with the private sector and with researchers. And I'm not sure what's the explanation of that. In a sense, I always come to these conferences and I see the level of competence and researches and the linkages that exist between individual research groups, universities, academicians, here around AIDS and globally. But this is not necessarily reflected in the dialogue, or to a limited extent, with the dialogue at the government level, at the central level. And, I think only yesterday I was talking to the Joint Secretary of the AIDS program, Dr. Dharma Rao, who again also mentioned that, the importance of that. He excused himself that he could not come because of his health status. And also the Secretary of Health, we have also talked about that. And with Dr. Ging, I was also discussing this in the sense, why did this happen? Why was there a kind of a parallel world develop? I do know you do interact with them, but why are we not using the capacities of India in terms of research, their findings, to the extent possible within the program? Maybe this is something for me to understand later on. Anyway, also Dr. Gilada brought up this morning the HIV bill. So as the speaker before me said, we do talk all the time about India's response. We see where the glass is half full and half empty. One of the successes in recent days, going towards a success, we hope in the parliamentary session in November, in the winter session, they do adopt the HIV bill, which is a work that has been going on since 2002. And where again, as Dr. Gilada mentioned, the partnership of civil society, parliamentarians, the communities, and government succeeded in pushing this forward. Where are the things that we need to focus on? And I talked about partnership. One is in terms of strategic innovation. And here I'm talking in the context of India in particular. In a sense, India has been a victim of its own success with regard to the years, the 2000s. Because a program on prevention, then followed by, in 2004, the introduction, at least on the government side of the introduction of treatment, there has been a strong talk about the successes of the scaled-up program, and some of the speakers before recited the levels of interventions that exist in India. And one of the most remarkable is that, going back to the history of the early 2000s, sir, and as you were mentioning, now there's a focus on 4 key populations. And those 4 key populations are central. We talk about sex work, men who have sex with men, transgender, and persons who inject drugs. And they have become, despite some challenges which we all know, they have become a reference around the world in India in the sense of how far you can go to scale in such a program. Currently, I think there's about 1,700 drop-in centers or programs or outreach teams working with these populations across India. And that's not sufficient. And yet we have problems with these issues. And we also have problems in identifying who else is vulnerable. I think when I say victim of successes, we, UNAIDS, WHO, and others have talked about the need to focus on key populations, and that is correct. But there's a secondary type vulnerability that we capture less in terms of the prevention programs and so forth. And here it's still notable and to be highlighted that there is a program addressing migrants and truckers, and there is at least the intent to address secondary transmission in the sense of the the partners in terms of injecting drug use towards sexual transmission and so forth. Somebody also before has made a good summary of the elimination of mother-to-child transmission. That is, as they say, one of the things that India should achieve. And it still has a way to go, as you saw by the statistics, but definitely it's something that is achievable. Our colleagues also talked about community-led approaches. There is an effort being done to involve community-based testing, to engage the communities further than as peer educators and outreach workers in adherence and potentially even in their role towards treatment. New strategies such as test and treat, PrEP, social media type strategies and all that are being discussed, but they should move them towards action very soon. In terms of the vision for the future with regard to India, and this is something I'm reflecting on it also from the point of view of what is UNAIDS' role, because our role is going to change, because our role is related to the epidemic and might over time disappear in that sense or take another form. But I think one of the most important forms it should take is what has been addressed, and I talked about the HIV bill, is that it addresses social exclusion. And as such, it provides a model for other health issues and other public health or human rights issues. By addressing these key populations and taking it just beyond that they are at risk of being infected, looking at their health in a wider context, looking at their social and human rights situation, we can address social exclusion. They are, of course, not the only population and not the largest population socially excluded in India, but definitely it's a learning that we can build on. In terms of finance, that is also one of the challenges. Currently, it's estimated that domestic finance covers around, it's an estimate, but 63% of the program. I mentioned Global Fund. I mentioned, to a certain extent, World Bank. Now, it can go to 100% domestic funding. As somebody said in the morning, I think it was Dr. Gilada. The resources are definitely there, whether in the public or private sector, but it's the decision that needs to be taken. And the problem is also within the health sector, if your spendings, if your budget is around only 1%, you're going to give a limited amount towards aid. So how do we carry out advocacy or commitment of government to take treatment costs on the long term? Since it's going to be, as was said, like a chronic disease, until we move forward on issues like cure and vaccines and so forth, how will that cost be sustained? And what is the role of the government and the pharmaceuticals in sustaining that cost? And it is true, because this is one of the important points, that although India shines in terms of its role in Africa, in Asia, with regard to generics and so forth, if there is a partnership that exists with regard to India, Also, those issues like stock out, like funding problems and all that with regard to medication, I think could be resolved. Other challenges which are, I'm not saying resolved, but since we interact with the government on central government and to a certain extent when we can at the state level and city level and so forth, is that they need to address issues of procurement, supply chain management, of reorganization, a bit also of the response. And to that, just to tell you that there is, I think, since the time I have been here, there is a discussion that's taking place within the Ministry of Health about how to link up and better work on the linkages between HIV, TB, about hepatitis, about other communicable diseases, and so forth. I think this kind of reorganization and re-strategizing within the health system is required, and the recent midterm appraisal did look into that. Of course, to conclude, I would just say in terms of UNAIDS' role, it is to work on this dimension of India's role in commodity security in Africa, in Asia, globally to a certain extent, to work on this role of mainstreaming the HIV issue into social exclusion agendas and broader health agendas, to assist in the integration aspect within health and healthcare issues. Not when I say integration is not to lose the specificity of and concerns with AIDS, and to manage to bring about, which is going to be difficult, but a commitment not on a yearly basis where services are cut because we're not sure if they're going to survive from year to year, but a long-term financial commitment towards HIV with the government in India. Yeah, with this, I wanted to share my thoughts also about the changing role of UNAIDS at country level and at global level. So thank you very much, sir.
You see a very candid and direct talk from UNAIDS. I really appreciate Mr. Oussama. Really, you are well done, because usually you people talk in a very much diplomatic language, which half of our people cannot understand. You have really spoken our hearts. Thank you.